So what do we do about this? Now that we know all this, what do we do? Well, yes, one of the things we can definitely do is, do activities to help heal our brain. The good news is things like the hippocampus, we can heal that. Okay. We've actually got some studies that show people who have, like, say, alcoholism, if they stop drinking, we start to see cell regeneration within 6 to 12 months. Some of the SSRIs or other antidepressants also tend to start to begin to grow that hippocampus again. Right? So doing things to exercise parts of your brain can be fun and it's healthy for us. And I just gave you some examples here. And eating, obviously, eating well is good. And when I say trauma-free foods, we're talking about things that don't tend to cause indigestion or cause inflammation, right? Things that don't have caffeine in it that get us wound up. So these tends to be foods that are good for the system as well as nutrition and make us feel good. So you can take a look at those at your leisure. Oops. Here's the big one though. You already know about this. This is the game changer. It's mindfulness. When we do mindful activities, we're actually helping our brain heal. Okay. We did one at the beginning today when I asked you to look around the room, notice one sound, two things that were oval, 3 things that were blue. That's a mindfulness activity. Anytime you take a breath, blow it out, that's a mindful activity. So anytime we are doing something to keep our brain in the present, we are helping it have positive experiences and helping it heal. I have a number of little easy activities that you can do yourself, and you can teach your clients, your kids, whatever. I did write these up for you in a handout because I know time-wise we won't be able to talk about all of them. But just to give you a couple of them, like the one flicking. So that's really just noticing tension in your body and then flicking it off. Flicking it, you can kick with your feet as well. Just doing some flicking. Okay, that. The straw breath is basically you take a breath in through your nose and you blow it out through your mouth, but you make a pucker like you're sucking on a straw and you're blowing out. So let me have you try it. Let's try flicking first. Just give yourself a good flick. Flick off the tensions of the day. Yes. And now let's take our breath and do our straw breath. Breath in and pucker it out. All right. If we can do more of these, if we have time, I'll go back to it, but just to be sure we get to everything. This is just images for you, effects of when we do exercise or when we do calming activities and mindfulness. We can see it in brain scans. Okay, so on our way to EMDR. So when it comes to therapy, we have what I would say is a huge development in our therapy world. And some of you may be familiar with this. It's called memory reconsolidation. Okay. And what it's basically saying is this. So we used to believe that once your brain was formed, that's it, it was formed. And once a memory was consolidated or digested, whatever shape it took, that was it, you're stuck with it. Okay. But as our knowledge of the brain is continuing on advancing more and more, we're learning that that's not true. All right. We have what's called neuroplasticity, right? Neuroplasticity is the ability to wake up dormant nerves and cells and get them active again. So if we have an experience, like I was saying before, like damage to our hippocampus because it's not utilized, or it's not getting the right nutrients in terms of cortisol that it needs to form memories to help us regulate our emotions, it goes kind of dormant, right? If we don't use it, you lose it, kind of thing. But we are able to wake those up, all right, doing things like mindfulness and some other formal therapies like EMDR, which we'll talk about. With memory reconsolidation, the other thing, okay, is that we also have, it's called neurogenesis. This is the ability to actually grow new neurons and new cells. Our brain can actually do this, okay, through doing mindfulness, through doing eating, through exercise, and through some formal therapy such as EMDR, which we'll get into. So we used to think, all right, and this was kind of some of the forms of exposure, if you will, right? Exposure treatments, where if we're stuck with what we've got, right, we can't change a memory. We've got this memory. Let's say a dog bit us, and we're scared of dogs now. We've got this memory. So what we do is, if we keep focusing on this upset event, right, we keep looking at it, talking about it, feeling about it, seeing images of it, right, and we keep going and going and going and stay on it, eventually we form a new memory. Okay, so the old one is still there, but there's a new memory, more current memory formed. And the hope is when we get, go in our life and different things trigger memories, that this new one will be triggered, or at least along with this one. So this one doesn't have such a big sting. So the more I look at somebody, a raging dog, and nothing happens to me, then the more, my brain will say, okay, you're safe now, right? So this has been the thinking. But now with memory reconsolidation, here's what that looks like. We know that we can access a memory, parts of a memory, open it up. So we need to get to it, open it up, all right? And while it's active, we're going to introduce it to updated information. We're going to introduce it to new information or corrective information. So we're going to challenge it. And that challenge takes that old memory, right, or that current memory, whatever it is, all right, and it just reworks it. So you still have the same memory, okay, only now your emotional reaction to it, your intellectual understanding of it, how you're experiencing it in your body change. Okay. So how do we do that, right? How do we take get to a memory, and how do we bring current information to it so that it can then say, okay, I don't have to be stuck in this way anymore because it's over. And this is what we'll talk about. EMDR is one of the options.